I'm here with Henry Pittman. His company is GSC 360. And Henry, you have a growing relationship with the HITLAB. Tell us a little bit about that.
Well, you know, Jim, it's very interesting. I came to Columbia University. I was taking their venture capital private equity program. And I asked a question. I said, who does healthcare innovation? And what entities are around in Columbia? And they said, we'll get back with you. And they came back and they said there was HITLAB and a couple others. And I reached out and HITLAB says, yeah, come on over. And that was over 2 years ago. Mm-hmm. And so it's just been a great experience with HITLAB. You know, as I started out at the basic level and they saw fit to allow me to be one of their global ambassadors. And so I like to go out and talk about healthcare innovation because particularly most of my life, healthcare innovation has been a part of my life, and so I really appreciate HITLAB, and they're one of our strategic partners.
Mm-hmm. So you had a chance to speak to the crowd today, and I know that you're basically a forward-thinking guy, have always been that way. Tell me a little bit about your message and how you think it was received.
Well, so our message is Vision 2040. What does healthcare integration, healthcare innovation, what does the healthcare system look like? Or maybe more importantly, what it should look like. And so the presentation was to stimulate thought leadership and to stimulate what should healthcare look like from us, from a government perspective, from foundations and charity, from a business perspective, and then what's our responsibility as individuals to transform our healthcare. Why? Because healthcare is not just a privilege, it's a right.
So what do you think the basic takeaways should be from your presentation?
Is at first at the individual level, that's where transformation begins, right? And that we need to empower ourselves when it comes to our own healthcare information. But we also need to empower ourselves about how we direct ourselves in healthcare. What's interesting is you and I have something in common. We produce our own health information, but we don't own it. So everyone else owns it. The provider owns it. The insurer owns it. Everyone but us owns it. Here's what's common though. Everyone doesn't understand our health information. So part of the message is we need to understand our health information. And then that then turns into actionable things that we can do to be preventive in nature. So that health issues that come our way that are preventable, we can prevent. And then those that maybe come down through hereditary and other environmental, then we can respond in a much quicker way. Mm-hmm. And so I think it's that integration that it starts, not with the government, not with business, not with charity, but it actually starts with us. Mm-hmm. And that we actually are empowered to have a better health outcome for ourselves.
So Stan Kashnowski was talking earlier today about the state of healthcare in the country.
Yes.
And it was not a pretty picture.
No.
We spend twice as much money on healthcare as the next nation. We rank 30th in healthcare outcomes. Where did things go wrong, and how do we make things right?
Well, I think where things have gone wrong is that we've lost the focus of what healthcare is. So first of all, I just, as I previously mentioned, it's not a privilege, it's a right.
Right.
Right? So everyone that is born, a doctor or a medical person said to a woman, you're pregnant. And then everyone, when they have died, there's a medical examiner that has to say you're dead. So healthcare is literally who we are, right? So it's not a privilege, it's a right. Once we get back to that focus that it's a right, then healthcare then becomes an enabler. The reason and what Stan and that committee and that chat was talking about was our system is broken because we think it's a privilege and not a right. Mm-hmm. Once we recognize that it's a right, then in the U.S., we got 340 million customers. How do we make them healthier? Right now, all of a sudden, we're now focusing the business aspects, the policy aspect, the charitable aspects to having a healthy lifestyle. Once we get back to that focus of a healthy lifestyle, then our synergies collectively integrated is to that end, you'll see our system get much better. Mm-hmm.
It used to be back in the day where you would go see the family doctor and the family doctor would cure what ails you. And then we evolved into the specialty care, where if that wasn't something that the doctor felt good about, they would refer you to somebody else. And we kept building layers on top of the original system. And now we're using information technology, health information technology, to basically return to that one-on-one sort of symbiotic relationship. The irony is, I don't think, is lost on anybody, but it's a complicated process to try to redirect the doctor-patient relationship.
It is complicated, but so the question you have to ask is, why did doctors become doctors? They became doctors to treat people. The administrative burdens that you just taught pulls them away from that. So through digital health platforms, integrated medical platforms, we can actually take those administrative burdens and lessen them for the doctors, giving them back time to be what really their passion and their calling is, which is to do healthcare. You talked about back in the day. Back in the day, we were much more preventative in nature. Back in the day, the local health folks would go to the schools and vaccinate people. Back in the day, the dental folks would go to the schools and every child would get a vaccine. Every child would get a dental checkup. And for those who had some medical issues, then they will be able to be referred. That's called triage, right? So back in the day, we did a lot more preventive, a lot more triage. Our lifestyle was different. We weren't so sedentary as we are now. We were much more active, right? We're not that way now.
Right.
So we can actually get back to there. And I think through digital platforms can actually empower us to get back to those things. You know, you have the wearables that talk about how many steps you take, what your exercise level, what your heart rate. All of that is good information, but what are we doing with that information, right? So again, our focus is to take all of this health information and turn it into actionable health information. Actionable health information then causes you to have to do something, right? And so this digital platform that we talked about that we're investing in, the digital platform to create that ecosystem for 360 million people by 2040 is designed to do it that way, right? And so what we want to do is now empower you, give you actionable information so that now you have dialogue and discussions with the doctors. And what I love about what the future talks about is how we take that information and say a guy or gal who has a GED or a guy or gal that has a PhD can get the same information through this platform broken down to their understanding so that they can still have a advocacy question and dialogue with their doctors. Because that's really what this information will do. We then become our own biggest advocates.
2040. Seems like a long way down the road, but it'll probably be here before most of us know it.
Yeah.
I keep coming back to what you said about us as a nation and as a people needing to take more ownership of our own health. You're talking about a radical cultural change. What people eat, what's out there available for them, the distractions of the phone and the media, and all these behaviors that we have now are basically unhealthy behaviors. You're talking about retraining the nation.
Yes. So it's a cultural mindset, but I would say it's probably going back to the beginning. So here's something that all of us have in common. All of us have in common is we don't want to die. So when we talk about changing behaviors, right, when you can show people that the behavior that you're engaging in is going to cause you to prematurely die, people then start to look and think differently. We just came out of COVID not too many long ago, and I can't tell you the number of people, patients, some of their last words was, if I had only known, right? How many times have people gone in to see the doctor and the doctor gives them bad news about cancer, and the doctor says, but if you had only come in 3 months ago, 6 months ago, and the patient goes, if I had only known that this behavior was going to lead to cancer, this behavior was going to lead to stroke, this behavior was going to lead to heart attacks. If I had only known. So yes, we are talking about it, but here's the thing, the infrastructure is already there. So we need to transform schools to train better, to teach better, to inculcate healthcare innovation throughout everything, no matter what your specialty is, right? To talk about what wellness really is, mental wellness, physical wellness, spiritual wellness, right? These are the things that we need to talk to people about, and the institutions are already there, so that we don't hear so many people go, if I had only known, right? In fact, that should be the new marketing theme. If you only knew that these behaviors, right? If you only knew, doctors go, I could have helped you.
Those of us who know you are not surprised about you dreaming big and talking about big change and revolutionary things like personal responsibility. How about that?
Yeah.
Wish you best on this crusade, because that's kind of what it is.
Yes.
And look forward to hearing from you as you march along.
Yes, well, thank you again for this opportunity, because our goal is to be that transformational catalyst so that others, can have a voice, so that we want to speak for those who don't have a voice. We want to advocate for those who don't feel like they can advocate. We want to be able to be that transformational agent that tells other people it's okay to transform things, it's okay to change things. And I love what you said. There's nothing wrong with us being accountable, but let our accountability start with us in our own healthcare. So thank you again.
All right, Henry, thanks.
Great.